So 20th question is, which of the following statements are correct regarding the renal cell carcinoma? So it arises from the epithelium of the proximal convoluted tubule. It has a female preponderance. Major subtypes are clear cell, papillary and chromophobe. And for this, surgery is the mainstay of treatment for organ confined disease. So for solving this question, we will go for a reference of Robin's pathology. So in the Robin's pathology, in the renal cell carcinoma, the incidence is, it shows a 2:1 male predominance. So it is twice in male as compared to female. So our option number second is wrong. So it doesn't have female preponderance, it has a male preponderance, and that is the twice. So it is twice as common in male as compared to female. So second is wrong. Now seeing other options, like third is the types. So what are the types of the renal cell carcinoma? So one is the clear cell carcinoma, which is majority. It is a 70 to 80% of the renal cell cancers are clear cell carcinoma. So it's the most common type. Now second is the papillary carcinoma. Then we have the chromophobe carcinoma. Then we have XP11 translocation carcinoma. And then we have collecting duct or Bellini duct carcinoma. So our option, the major subtypes are clear cell, papillary and chromophobe is correct, and clear cell is the most common. So third option is correct. Then it arises from the epithelium of proximal convoluted tubule. So for that we have to see the origin. So it writes that the clear cell carcinoma arises from the proximal convoluted tubular epithelium, and because the clear cell carcinoma is most common, we can say that the renal cell carcinoma most commonly arises from the proximal convoluted tubule. So from the PCT it arises. Other types like the papillary carcinoma thought to arise from the distal convoluted tubule. So papillary carcinoma arises from the distal convoluted tubule. And then we have the other types like the chromophobe carcinoma. So for the chromophobe, like the benign oncocytoma, they are thought to grow from the intercalated cells of the collecting ducts. So chromophobe carcinoma arises from the intercalated cells of collecting duct. So coming to option number 1, it arises from the epithelium of the proximal convoluted tubule. This is the correct, because the majority is your clear cell carcinoma, and clear cell carcinoma arises from the proximal convoluted tubule. So we can see that the clear cell carcinoma arises from the proximal convoluted tubule, papillary carcinoma arises from the distal convoluted tubule, and the chromophobe type arises from the intercalated cells of collecting duct. But because majority is clear cell carcinoma, so it arises from the proximal, so this is also correct. Now surgery is the mainstay of treatment for organ confined disease. So Robbins writes that radical nephrectomy has been the treatment of choice, but nephron sparing surgery to preserve renal functions recommended for T1A tumor less than 4 cm as well as larger tumor when technically feasible. Drugs that inhibit vascular endothelial growth factor and various tyrosine kinases are used in adjunct to therapy for metastatic disease. The Bailey writes that renal adenocarcinoma responds poorly to radiotherapy and conventional chemotherapy. So renal adenocarcinoma doesn't have role of radiotherapy and conventional chemotherapy. So our option number 4, that the surgery is the mainstay of treatment for organ confined disease, is correct. So our option number 1, 3 and 4 are correct.